Are you already registered at Wikisana?
Hello and welcome to our natural medicine format. Nice to have you back. Today I welcome Karl Müller. He is a graduate engineer and a motion scientist. And today we want to talk about disc accidents. How do they come about and what can you do best to regenerate? Stay tuned, we'll start the conversation right away. Hello dear Karl, nice to have you here. I'm very happy.
Thank you for the invitation.
With the development of your Kaiben shoes, you have been instrumental in multiple successes or multiple regenerations of various problems on the movement apparatus. Today we want to talk about disc accidents. It is a word that is often heard, but maybe we want to briefly introduce how a disc accident comes about. Why does it come about?
Simply put, it comes about because the vertebrae do not stand physiologically. If the fins were to stand vertically on top of each other, more or less in motion, of course, they move very, very easily, then the disc would stay nicely in the vertebrae. Because they are nicely embedded there. But if the vertebrae constantly move forward a bit, because we move forward more and more, especially in age, by sitting, the front fascia chains are shortened, the front muscles tighten more than the rear ones. And this leads to the disc being pushed out of the vertebrae to the rear of the body. And this has to do with everyday life. Actually, all problems with our body have to do with everyday life. Either because we have too much stress, because we eat unhealthy, or because we do not move as much in everyday life as the body would like to do from nature. These are the possibilities. And it all has to do with our behavior in everyday life.
So, too little movement. Not that we behave wrongly, but probably too little movement, right?
I don't agree with that at all. I think we have too little movement. We have the wrong movement. We don't have too little movement. Many problems arise because we move wrongly. For example, sitting a lot. Sitting is the new smoking. Those who sit longer are sooner dead. There are such sayings. They all hold their truth. When we sit like this, or even when we work in everyday life, we lift wrongly when we have never had problems before. And we lift something. Then we normally lift it wrongly. Only when we know that you should not bend forward when you lift something, but that you should sit down with a straight back and lift it like this, then we know that we have done something wrong. And these habits in everyday life are actually the cause of almost all health problems that we have.
Now disc accidents are extremely painful. How do you prescribe it in a classical medical way? In most cases, I know it as an operation.
Yes, unfortunately, it is operated much too quickly, also in the case of disc accidents, instead of doing something about the cause. It's just that in the case of disc accidents, you can't just put it back in. There are also cases where you can put something back in through manual manipulation. But disc accidents are rather long-term. It comes slowly, and it doesn't go that fast until it's over again. There are therapy forms, where you do everything backwards. Personally, I think that's good, but you shouldn't overdo it. Just move backwards, rather in the direction of the hollow cross, and thus push the disc back in. But it doesn't go too fast, because the muscles block it. There are so many muscles around the vertebrae, around the disc, lateral muscles, there are muscles in the back and in the front, around the spine, there are so many small muscles, deep and superficial, that build up so-called protective tensions.
Kleine Muskeln, tiefe und oberflächliche, die sogenannte Schutzspannungen aufbauen.
By the way, there are very good shows on QS24 by Dr. Meyer. I advise everyone to watch them. These protective tensions are there to protect the disc.
Sind dafür da, eben die Bandscheiben zu schützen.
And if the muscles in the back and in the front, the agonists and antagonists, or also on the side, if they hold on, then none of them wants to let go. On the whole back, everyone wants to block them. If you stretch, it may be that they tense even more, because everyone believes that every muscle has the task not to let go, because otherwise the disc will jump out.
Jeder Muskel glaubt, hat die Aufgabe, nicht loszulassen, weil sonst die Bandscheibe rausspringt.
So which one lets go first? That's why you sometimes inject cortisone, which can even have a short-term effect, which, of course, destroys the structures in the medium and long term, destroys the tissue.
Mittelfristig, längerfristig natürlich die Strukturen zerstört, das Gewebe zerstört.
That's why maximum caution is required when there are blockages.
Wenn Blockaden da sind,
Dr. Meyer, for example, has alternatives. And in the long term, you also have to ask yourself in parallel, what am I doing wrong in everyday life? Where does it come from? And what is partly responsible in my everyday life that this disc accident happened? And very often the sitting is partly responsible, and then also the walking and the whole history of the movement apparatus. For example, if I have an accident, Achilles tendon, sport Achilles tendon inflammation, Achilles tendon rupture, or a ligament injury in the foot, or whatever, that then causes osteoarthritis.
Bänderverletzung im Fuß oder was auch immer. Das ruft dann schon Haltungen hervor.
Especially if you then get these clumped feet, i.e. these shoes, these heavy shoes, where the ankle is placed still for 4 to 6 weeks, then during this time you are limping.
Wo das Fußgelenk 4 bis 6 Wochen stillgelegt wird, dann während dieser Zeit hinkt man.
And this unconscious, this hanging, when the shoe is gone again, the limping goes on.
Dann wieder weg ist, geht das Hinken weiter.
Because the movement sequence in the brain and in the fascia, in the muscle fascia is stored, that remains.
In den Muskelfaszien abgespeichert ist, bleibt das.
And this retention can be left-right, it can be front-back, often it is a combination. It can also be a constriction in the pelvis. This then triggers scoliosis. You may have already had scoliosis, or that can trigger one. And these retention build up this protective tension in the spine. And if you want to solve this by stretching, without doing anything on the gait picture, or bending forward, without working on this in everyday life, this will always happen, and it won't be good.
Nach dem Vorne beugen, ohne an dem im Alltag arbeitet, kommt das immer wieder und das kommt nicht gut.
These protective tensions are very, very difficult to get rid of. And it is always important to ask yourself in everyday life, what should I do? For example, here I am sitting on a chair now, but at home I only have a measured chair, otherwise I move on the floor. I sit cross-legged, or somehow always differently. You should move in a very varied way, not just sit like this, and here again and again switch right and left, stretch a little, move the fascia a little, very varied, move in a varied way, so that the fascia don't fall into a one-sidedness and thus don't stick together, because one-sidedness sticks together.
Sehr variantenreich sich bewegen, damit die Faszien nicht in eine Einseitigkeit verfallen und dadurch auch nicht sich verkleben, weil Einseitigkeit verklebt.
And yes, this is something you should always do parallel. Where does it come from? Ask yourself, where does the disc damage come from? And then try this and that, and you will see that you get to know the body better and better.
Dass man den Körper auch immer besser kennenlernt so.
So, actually, one would need, after you have described this, let's say, shoe, which you described so beautifully earlier, when you have taken in a posture, after it is gone, you would need something like health gymnastics or physiotherapy to get used to this posture again, right?
Health gymnastics and physiotherapy are certainly good to learn there what to do, but in everyday life. For example, if we now take this blocking shoe and take a look at this picture, then you can see the skeleton on the right, and a shoe that blocks, or even the hard, flat floor, limits the movement of the feet. Then you can see that the foot on the right simply folds on the floor. It is a folding foot, and such a plaster is more or less a plaster, such a shoe, which blocks the movement of the feet.
So auf den Boden, das ist ein Klappfuß. Und so ein Gips ist ja mehr oder weniger ein Gips, so ein Schuh, oder? Der blockiert ja die Bewegung der Füße.
The feet are there to move. If you compare left and right, then you can see the feet on the left skeleton turn the wheels very strongly and accordingly. The movement of the knees, the pelvis moves upright. And if the foot only folds downwards, it gets weaker and weaker, and also the balancing ability decreases on the right. And if you reverse that so that you learn to walk completely differently, the feet move strongly, just like on the left.
Und wenn man das wieder rückgängig macht, indem man eben lernt, ganz anders zu gehen, die Füße kräftig bewegt, so wie links,
then the body straightens up, and then such protective tensions also in everyday life are automatically released. The shoulders go more to the back, then the muscles notice that they pull in the back, because it pulls forward.
Dann merken die Muskeln, die hinten ziehen, weil es eben vorne zieht.
They can let go, so if it does not pull down in the front anymore, then the muscles in the back automatically notice. Now I can let go slowly. This is a process that takes weeks and months. It takes a very long time, and you also need endurance if you really want to solve it in a natural way. And it is simply advisable to do this. There are accelerating processes, such as injections, or
Es gibt beschleunigende Prozesse, eben wie Spritzen oder
certain manual therapeutic measures.
But it does not bring me back into a natural course, does it?
Yes, exactly. At the moment it can help, at the moment it solves something, but if I do nothing in everyday life against it, if I only do physiotherapy and not in everyday life, then I will never get out of these restraints and these protective tensions.
Und nicht im Alltag, da werde ich nie aus diesen Schonhaltungen und aus diesen Schutzspannungen herauskommen.
Well, you have already said that it is the hard floors, for example, that simply create a problem if we constantly only move on them. What is the solution for everyday life?
Wenn wir uns ständig nur darauf bewegen, was ist dann die Lösung?
Die Lösung ist, dass wir
Exactly. You see on the left this human being. This is a Maasai human being. How he moves, how his feet move, the feet. There is strength, balancing ability, and mobility in them. And on the foot, on the right skeleton or on the very right, on this human being. Practically on all elderly people you can see that they only let their feet fall. And block the hips in the knees and the hips. And if you want to do something there, then you have to work on your feet in everyday life. In this case you can do that by consciously pulling a shoe with a soft sole, very consciously pulling strongly, from the back to the front, pulling strongly.
Indem man einen Schuh mit einer weichen Sohle ganz bewusst kräftig abrollt, von hinten nach vorne kräftig abrollt, sich aufrichtet.
Straightening up and moving a bit like the skeleton on the left. Of course you could also use our shoes for that.
Könnte man auch unsere Schuhe dazu benutzen.
But these shoes are not a must. Actually, these shoes support this natural movement. It is much easier. They constantly explain to you, and it works more automatically. But of course you can also do it without our shoes. Simply consciously roll up your feet strongly. Straighten up. Yes, walk like you see. You can do it better simply by the emotional, by the visual view of this skeleton. You can do it almost better than by explaining it with words.
Yes, it is very clear how it should look like, and the left skeleton is also much more harmonious in terms of movement than the right one. With the right one you have the feeling that the components do not belong together. And it really hurts when watching.
It is angular, it chokes, and the other one is harmonious. It is round, and it starts on the foot, with strength, mobility, and balanceability on the foot. That is a key. And then if I walk like this,
das ist ein Schlüssel. Und dann geht die Bandscheibe, also wenn ich dann ständig so gehe,
then the skeleton cannot go back at all, but it goes back, everything together. The protective tensions gradually dissolve from bottom to top, or from top to bottom, from left to right. That is individually different. They dissolve automatically until the protective tensions are gone, dissolved, and the natural walk has taken over, because the natural walk is a sign of the arm swing, the rotation in the thoracic spine. If it does not rotate as you can see on the right, then it is because the protective tensions
Einzug gehalten hat. Denn beim natürlichen Galgen ist dann auch ein Zeichen dieser Armschwung, die Rotation in der Brustwirbelsäule. Wenn die nicht mehr rotiert, wie man rechts sieht, dann ist das, weil Schutzspannungen
block the whole system.
Don't they? Yes. Now you are saying that one can do it very deliberately by paying attention to the rolling of the feet. How long should one ideally practice this in order to succeed?
Wie lang am Tag sollte man das denn idealerweise praktizieren, zum Erfolg zu kommen?
As often as possible. In my case it would not be necessary, because I have been doing it for 25 years. The goal is that at some point if one does it either deliberately or with our shoes, that it becomes one's own movement, that my body becomes one's own course pattern, and then one can somehow walk on hard ground and one will always roll with one's feet vigorously.
Jetzt mit unseren Schuhen das macht, dass das zum eigenen Bewegungsablauf wird, dass das mein körpereigener Gangmuster wird. Und dann muss man, dann kann man irgendwie gehen auf harten Böden und man wird immer kräftig mit den Füßen rollen.
So this is the least time-consuming thing, because then it simply becomes part of everyday life, isn't it?
Yes, this is still a side effect, that it does not require time. In the beginning, of course, one needs the support of professionals, besides Dr. Meyer, who is certainly an absolute top expert, other physiotherapists, fascia teachers, fascia therapists, they can certainly also support you, but one cannot do something that quickly.
Man kann da gar nicht zu schnell einfach etwas machen.
It is not possible simply with a few therapy. Sessions, because there is a lot more behind it, because
Da ist
these
einiges mehr dahinter, weil diese
protections and these
Schonhaltungen
protective
und
tensions are so complex and old that
Schutzspannungen, die sind dermaßen komplex und alt eingesessen, dass sich
not
nicht
everything dissolves at once.
alles auf einmal auflöst.
Well, I have already learned in many conversations with you what you actually target, or what the shoes are supposed to target, and I totally get it, so it is simply.
Beziehungsweise was die Schuhe bezwecken sollen, und das leuchtet mir total ein. Also es ist eben einfach dem zu schulden,
Because
dass
in our
wir
everyday
in
life we
unserem
no
Alltag
longer find natural
nicht mehr
grounds,
natürliche
i.e.,
Böden vorfinden,
where we
da, wo wir
move,
uns
whether on
bewegen,
the
ob
street
auf
or
der
at home,
Straße oder
but it
zu
would
Hause,
actually only be on the meadow.
sondern es wäre
But who
eigentlich nur
goes?
noch
I do
auf der
not know
Wiese,
when
aber
I
mir
last
geht's schon
walked
nicht bestimmt,
barefoot
wann
over
ich
the
zuletzt
meadow.
barfuß über die Wiese gelaufen bin.
Yes,
Ja,
that is
aber
not enough from these
das
few
reicht
times that you
nicht
walk
aus,
barefoot
diese
on the meadow
paar
that
Mal
shows you
einmal
how
pro
pleasant
Jahr
walking could be, but
barfuß
that is
auf der
not enough
Wiese
to change
gehen.
your
Das
walking
ist
pattern.
zwar das zeigt einem, wie angenehm gehen sein könnte, aber das reicht nicht,
Ja.
um sein Gangmuster zu verändern.
So in the shoes that you have developed or that you have developed, there is simply the advantage that this natural ground is perceived, at least that is what I have always understood.
Natürliche Untergrund nachempfunden wird. So habe ich das jedenfalls
Ja,
immer wieder
genau.
verstanden.
Exactly,
Genau,
it
es
actually
macht
makes this
eigentlich
hard,
diesen
flat ground
harten,
soft,
flachen Boden
elastic,
macht's
springy,
weich,
pleasant,
elastisch,
because
fair und
between the
angenehm.
feet and the
Aber
hard,
zwischen
flat
den
ground there
Füßen
is.
und dem harten, flachen Boden ist so eine
A sole
eine
inside that is soft,
Sohle
elastic,
drinnen,
springy, and
die
then you
weich
automatically roll
elastisch,
off, as if you
federnd,
walk in the
und
sand.
da rollt man dann automatisch ab, wie wenn man im Sand geht.
And you always
Und
tell
du sagst
yourself,
dem
go in the
Gegenüber,
sand
ohne
without rolling
abzurollen,
off,
das
that
geht
does
gar
not
nicht.
work at all. You
Man
will
wird
roll
abrollen,
off,
weil der
because the sand
Sand
sinks in
das
and you
sinkt
will
ein,
always
man
roll
wird
off in
immer
the
abrollen
sand,
im
and
Sand,
also
und
in these
diese
shoes.
Schuhen
You
auch.
will always roll off,
Wird man
because
immer
it goes
abrollen,
deep
weil
in the
das
back.
das geht tief hinten rein,
And then you push
und
forward, and then
dann
it
drückt
springs a
man nach
little
vorne
elastic.
und dann federt das so ein bisschen elastisch.
That's
Stimmt,
true,
wenn ich
if
mich
I
an meine
remember my
letzten
last sand
Sandgänge
walks, that's
entsinne,
true,
das stimmt, ja,
yes,
ja,
of
genau.
course, yes,
Aber ja, in
indeed,
der Tat,
but we have
wir
such
haben
grounds in everyday life
solche
too rarely.
Untergründe einfach im Alltag zu selten. Jetzt
Now you
könnte
could
man
say,
ja
there are
sagen, ja,
various
es gibt
inlays
ja
from many manufacturers.
diverse
What? Where
Einlagen
are the
von
differences? You can certainly
vielerlei
answer that very
Herstellern.
well.
Wo sind denn die Unterschiede? Das kannst du mir sicher ganz gut beantworten.
Ja, gut,
Inlays do
Einlagen
exactly the
machen genau
opposite.
das
We promote the
Gegenteil.
movement in the foot and inlays limit it.
Wir
Then you go even more like in this
fördern
skeleton
ja
on the
die
left,
Bewegung
and then you fall
im
forward,
Fuß,
and
und
when the spine
Einlagen
falls forward,
limitieren die.
then it
Da
pushes the
geht man
discs
dann
out
noch
again.
mehr so wie bei diesem Skelett links, und dann fällt man nach vorne, und dann, wenn die Wirbelsäule nach vorne fällt, dann drückt es halt die Bandscheiben wieder raus.
In order to
Um die
push the discs back
Bandscheiben
in,
wieder
you have to straighten
reinzudrücken,
up and rather
muss
into the
man
active
sich
hollow back.
aufrichten
Physiotherapists, when you
und
say,
eher
you
so
have to go
ins
into
aktive
hyperlordosis.
Hohlkreuz. Physiotherapeuten, wenn man sagt, du musst in die Hyperlordose oder in die
You have to use the lordosis to go. Then they
Lordosis
say, no,
nutzen,
that's not
zu
right at
gehen. Und
all.
dann sagen,
But that's an
das
active
ist
one.
gar
The
nicht richtig,
lordosis is a
aber das
natural
ist ja
one. That's the
eine
curvature of the
aktive. Die
spine.
Lordose ist ja eine natürliche, das ist ja die Krümmung der Wirbelsäule.
In this
Da in
case in the
diesem
lumbar
Fall jetzt
vertebrae,
im
and because it is active,
Lendenwirbelbereich.
that is, because the
Und
muscles
weil
work
die
in this time,
aktiv ist,
it is
das heißt,
completely
weil die
harmless. So
Muskeln
if I go like this,
arbeiten
I
in
will
dieser
never.
Zeit, ist das völlig ungefährlich. Also wenn ich so gehe, werde ich nie einen
Get a herniated disc, on the contrary, I can correct it by doing so.
Ich kann den dadurch korrigieren.
So that means I have a good prevention by doing so, that's one thing.
Ja,
Yes,
Therapie
therapy
auch
and
und
prevention.
So two birds with one stone.
Yes, it would be good if you would go like this preventively. The human being and I are no exception. We are like that we always have to cross the line to learn something. In young years you think, I can eat what I want, my stomach, my intestine, they can take everything, and somehow in old age you realize that you should eat well.
Was ich will, mein Magen, mein Darm, die halten alles aus. Und irgendwie im Alter merkt man dann, dass man sollte sich gut ernähren, dass man
So that you also have a long-term healthy stomach and
auch
intestine.
langfristigen gesunden Magen-Darm-Trakt hat.
That's the deceitful thing. The body is so fantastic in its performance and tries as long as possible to compensate things, but at some point the possibilities are exhausted to continue to compensate things.
Dinge weiter zu kompensieren.
Exactly, that's exactly it. The body is genius. On the one hand, it compensates whatever it can, and if you have learned, then it also supports you in healing, so you can intervene from the outside and quickly operate on something. But that's the abbreviation, and not in the sense of the body. The body has incredible possibilities to heal itself again, if you also support it in this way.
Aber das ist die Abkürzung und nicht im Sinne des Körpers. Der Körper hat unglaubliche Möglichkeiten, sich wieder selbst zu heilen, wenn man ihn dann auch in dieser Weise
If you put it in this position.
in die Lage dazu versetzt. Ne?
Exactly.
Okay.
Okay, so it makes total sense to me, and I can absolutely imagine that.
Und kann ich mir absolut so vorstellen.
Where
Wo
do you
findet man
find more
denn
information
weitere
about your
Informationen
developments,
jetzt
about your shoes?
zu deinen Entwicklungen, zu deinen Schuhen?
Well, if you want to change your walk quite simply, even without doing it yourself, then you can find everything on kaiban.com on the internet or Kaiban Johar. You can find everything there. You can also search for back pain or herniated disc, and then you can find the corresponding information, exercises, also very concrete exercises, what you can do.
Findet man alles Mögliche, dann kann man dort auch Bandscheibenvorfall oder Rückenschmerzen geben oder Kniearthrose, und dann findet man jeweils die entsprechenden Informationen, Übungen, auch ganz konkrete Übungen, was man machen kann.
Wonderful. There are already several interviews that we have conducted with you, and where you have already pointed out many corresponding problems in the movement apparatus and what the solution could look like, so the audience can make themselves smart.
Hingewiesen hast und wie die Lösung aussehen könnte. Also auch da können sich die Zuschauerinnen und Zuschauer schlau machen.
Thank you for the moment, for this interview, for this, let's say, folk disease. I think you can almost call it that, because we all have a problematic movement or behavior pattern in our lives.
Weil wir alle eben einfach ein problematisches Bewegungs- oder auch Verhaltensmuster uns aneignen im Laufe des Lebens. Gewohnheiten. Genau, richtig.
I thank you and look forward to our next interviews, more about our movement pattern or apparatus, and beyond that, you have completely different qualities, specialties, which we will also talk about.
Du hast ja noch ganz andere Qualitäten, Fachgebiete, worüber wir auch noch sprechen werden.
I'm looking forward to it. Thank you very much. I also thank you very much, dear viewers, that you were there, and maybe you have also been helped with the insights you have gained from this interview. You don't have to suffer from diseases of the movement apparatus. There are also solutions that do not necessarily have to do with an operation. We thank you for watching, and please stay attentive, watchful, and also loving to yourself. See you next time. Goodbye.